Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. Hi, precious listener. Thank you for tuning in to a brand new episode. And for today, I have Claire Brecher on the show, and she will be talking with me on the good enough mother. And that's so appropriate for mothers in this time and age. And you will find out why. Claire Brecher has practiced as a midwife for 35 years, and over this time, her passion for a chosen field has broadened and deepened. She has looked at midwifery from every angle imaginable, working in labor wards, running an antenatal and postnatal practice, lecturing and conducting research in midwifery at the Wits University. She is also an international board-certified lactation consultant and certified infant massage instructor, and has a certification in integral life coaching from UCT. Her latest achievement is that she's established and founded the Good Enough Mother Connection, where she brings all her experience and skills together to provide new parents with a platform to navigate the new and demanding world of parenthood. I know you will be in for a treat with this very insightful and important episode. Welcome, Claire. I'm so excited that you are joining me for this show. How are you doing today?
Very well, thank you. It's a beautiful, beautiful day in Johannesburg.
Oh, lovely. It's summer, hey? Don't you love it?
Yeah,
Claire.
We waited a while for it. It's gorgeous.
Oh, it's awesome, isn't it? Claire, I'm really grateful for reaching out and to share some of your incredible wisdom and knowledge that you've gained over all these years. You've had quite an impressive journey with so many different experiences that has led to who you are now and what you're doing now. So tell us a little bit more about yourself.
Okay, well, in terms of my midwifery and my professional life, I trained as a nurse originally, and then I found midwifery, and I absolutely maintain that if I hadn't found midwifery, I would not have stayed in the healthcare field. Midwifery has been a passion of mine for 35 years. And through that, I've worked in labour wards, postnatal wards, very briefly, but a postnatal practice. I've run an antenatal and postnatal practice a couple of times myself. I set up the postnatal practice at Genesis when Genesis first opened. I've worked in neonatal ICU. And then for the last 9 years, I've been lecturing at Wits University in midwifery. I actually left just over a year ago. And I've trained as an integral life coach through UCT, and I'm an IBCLC certified, international board certified lactation consultant. So all of that kind of, and related to midwifery.
That's very impressive. So you have
It means I've been around a long time.
Yeah. No, and I'm sure you've got so much experience and wisdom to share. So what are you busy doing now? And I know you're passionate about something specific. Tell us a bit more about that.
Yeah, so when I left the academic environment just over a year ago, I decided that I really, really wanted to rekindle my own private clinical practice. So the obvious thing to do was to go back into the work of working as a lactation consultant. But two things I found there, that field is a little bit, there's an awful lot of people now who are qualified by whichever qualification, lactation consultants. But what really struck me when I was working with mums is their need, and it wasn't just their need around clinical advice and, not just advice. It was this, what I found with the new mums and new families that I was working with, that they almost seemed to be like in a state of crisis, this quest for perfection, this quest for their, obviously, largely millennials, and I know we don't like to generalize completely, but the great knowledge gatherers. And now they're faced with the task of applying this vast body of knowledge that they're collecting, and in some ways is being thrown at them. I'm sure we'll talk about social media and all of these things. And the kind of crisis they find themselves in as new parents, trying to navigate this new landscape. So that sort of led me to look into that a little bit more deeply and more broadly. And what I've done is I've created a practice that I've called the Good Enough Mother Connection. And I'll explain the name if you want me to.
Yeah,
and it really is, well, it's from Donald Winnicott, was a pediatrician who first coined that phrase in 1953, which is an indication to us that this is nothing new, but I think we've kind of chosen to ignore it. And I think that whole quest for perfection is driven on many levels. It's consumer driven, it's driven from maybe the healthcare professionals. Yes, it's a complicated place that I think new parents find themselves in. So my aim is to provide a platform, a space where they can actually be really authentic. They can talk about their fears. There's no competition involved. And that we help them to find ways and skills to navigate this new space and to kind of find who they are as parents. And one of the sessions I run is actually from partners to parenthood, and it's all of those kind of things, making this transition. Amazing. Not buying into the almost, well, it's not medieval, not buying into the myth of the maternal instinct, which I don't believe is real. Neuroscience tells us it's not real.
Oh, that's interesting. We need to talk about that too. Well, that's a beautiful journey that you've embarked on, and I'm sure quite rewarding. How do you find the Good Enough Mom connection connects with the millennial moms? How's that experience been since it's been going?
Well, it's embryonic. Yeah. And so I'm actually just finishing off creating my website, and I think last year I spent a lot of time sort of putting the ideas together and trying out different things. So how do I think it's connecting? I think it's landing quite well with them. That it's, wow, I really need this. And the moms who I've connected with, who come to the groups, who I see one-on-one for coaching, definitely come back. And a lot of my philosophy has always been that I never want to create dependency in the people who see me. I think it's a huge, almost egotistical risk of healthcare professionals. And that I want them to be able to form their own connection with maybe like-minded women in the area. That they find who they are and that they can move on. That this is almost like a springboard for them. Yeah,
beautiful. No, I totally witness of that. It's the danger of building people into yourself, but you need to, not make them dependent on you, but give them the tools to make it.
Yeah.
So that's beautiful. So with your experience and how you've been going, can you unpack it a little bit of how can we help our 2023 newborn parents?
So when you say we, do you mean we as the healthcare professionals, or are you talking to the mothers themselves?
We can
or a bit of both.
We can do both. Yeah, I think because we've got both people listening into this podcast. On the one hand, it's healthcare professionals, midwives, doulas, whatsoever, and then a mommy. So we can tackle both.
Okay. Well, one of the things that I think definitely that the new families, and I just want to emphasize, I do use the word mother. And when I actually present to a pregnancy group, and when I speak to them, I explain that I use the word mother because as a midwife, I have always dealt with the physical and emotional needs of a woman, and that physically it is the woman who births the baby. And that is a reality, however else, whatever goes on in the world. But my practice is not only for gestational mothers. I want to be quite clear about that. It is for new parents, and new parents in all their guises. But I have always felt myself pulled towards the mother because of my background. So these new parents, pregnant parents, expecting parents, they face a barrage of information. So the social media, there's a rose-tinted view of what pregnancy and birth is going to be like and the afterlife with a baby. Everything's sort of Insta-fied. And so that is one thing I think, to go in being wary of that, to see it for what it is. And I also think that healthcare professionals largely don't engage with in dialogue with with the fact they call them patients for a start off when they're dealing with what is largely a healthy community, and that they often don't include the pregnant or the birthing parents in the decision-making processes. And I clearly do understand that there comes a point where you go to a healthcare professional because they're going to call the shots in those crucial moments in a birth. But telling people what is going on is not engaging them in their care. And one of the things I do is I do a debrief of the birth, and I work with birth trauma. And more, the clients were coming to me explaining that they didn't feel like they were part of the process. So for the pregnant parents, it's finding a way to become part of the process, finding a way to gain self-mastery, which means really understanding the information that's given to you, not being afraid to ask and say, I don't understand that. And an example I would give is that a lot of medical practitioners will use a scan a lot. The babies will be, and the mums will be scanned on every visit. And then we get the fetal medicine talk going on. And I've been a midwife for years, and my fetal medicine talk isn't great. I'm really not very fluent in it. So I don't know how those parents would feel having a fetal medicine orientated conversation. So that's one of the things. I feel that there's a distance between the caregivers and them, that their needs are not being met. That's one thing. Social media. And then their outside world, the whole pressure from family and friends as well, who possibly are very keen to give advice. And a lot of this then leads to build basically guilt and shame, because once you've got these incredibly high expectations of yourself and you invariably fail, you're left, these people are left with intense feelings of guilt and shame.
Yes.
I don't know if that really answers your question. So you're saying about how can they help themselves? I think parents can help parents. People must be truthful about what pregnancy and childbirth is about.
Yes.
And we seem to operate on the spectrum that it's either the sort of glowy view, the water birth and the soft music, or at the other end of the spectrum, it's just screaming and it's awful. And somewhere in the middle sits most people's experience.
That's right. Yeah.
And yet somehow the truth doesn't get told. And because of the competitive element that seems to be around parenting, I sometimes think that new parents don't tell each other the truth either. And there's a lot of judgment that goes into it.
Yeah.
So I think, be cautious of social media. Make your healthcare professionals work for you. They're service providers. They're not demigods. They're no more clever than anybody else. They just have a particular skill set. They have knowledge and a particular skill set.
Correct.
And to try and almost create a philosophy around what is important to you, but a working philosophy, because I'm going to use the birth plan as an analogy here. I mean, we know people spend hours writing their birth plans, and they also can lead to huge feelings of disappointment and failure when they can't be achieved. So, like all of these things, working plans, keep the edges fuzzy. See what becomes important to you.
Yeah, for sure. And it's such crucial things you're saying. And when I listen to you, I almost hear like there's almost like a bit of two extremes. So it is the one side, the almost too little empowered parent, and on the other side, the overly empowered, informed parent that has just got the massive extent of making
and maybe it's the word empowered. Maybe the word empowered is the empowerment is lacking, because they've got all this knowledge.
Yes.
But the application of knowledge, that for me is sometimes it's not working. So let me keep on gathering information. But at the end of it, I use a model of resilience as sort of the backdrop to my practice. And you look at self-mastery, self-esteem, self-efficacy, and your social support. And those are the pillars that I think we as healthcare professionals should be aware. Are we actually providing this?
Yeah.
Not worrying so much about our self-esteem and our egos, but worrying about our clients.
Yes. Yeah, absolutely. Wow. So when you are dealing with women, and you even mentioned birth trauma and so forth, what are the take-home messages that you would love to give to women? When would you say they would need someone like you to come to them?
Well, they don't even. I mean, I'd love them to come to see me, but obviously, what could
I'm
they
sure
do?
you try to prevent something from happening.
Well, of course.
Yeah.
But one of the things for the birth stories, and in Michelle Obama's words, everybody has a story to tell, and it's your story, and own the story.
Yes.
And what happens is people want to sanitize the story. They want to make it acceptable. So when you're going through the birth, you can't tell the story. It's all happening around you. There's no story to tell. And then the next step of the storytelling would be that you're very grateful, and you're just grateful because you're okay and your baby's okay. But then as they move away a little bit from it, then they start to have these reflective thoughts. And by trauma, it isn't always physical trauma. It can be a take-home comment that the midwife or the doctor made to the mother during the process of birth or afterwards that resonates with that woman so deeply that she can't move on from that experience. So even if the healthcare professionals could go in and explain and say, what did you not understand about what happened yesterday? Would be like a really good starting point.
Correct.
Because we all, and you're a midwife, I'm a midwife, we love talking birth stories. I mean, what midwife doesn't love it? But if you and I had a conversation about a birth story, we'd talk in our own language.
Correct.
And a lot of that obviously goes on in the clinical space. So maybe unpacking some of the things that happened. And then I think the healthcare professionals would have to bring a degree of vulnerability to it as well. They'd have to be open to maybe what they said was hurtful or harmful. Yeah. But I don't know how would the new highly elated couple in that phase be ready to say something. But yeah, so that's, and knowing that it's important to tell your story, and that I've talked about this birth trauma and birth stories to people sort of even my own age group, and the stories that have come out and the conversations that have come out, and these are 30 and 40 years later. Yeah. And afterwards, women have said to me, I needed to tell that story and I didn't know how much I needed to tell it.
Wow.
So that's a good, it's a big one.
Yeah. No, that's
and they're not always traumatic. They're not. Sometimes there's so much joy in them as well, and it's a mix of everything.
Yeah, no, but you really addressing an important point. I think every woman needs to tell her birth story and formulate it correctly in her memories and process them.
And make sense of it, and make a sense of it that's meaningful to her, not that's just sanitized and acceptable to tell at book club or when I meet my friends in the park.
Yeah, for sure.
She needs to create meaning for herself in it.
Yeah. So if we let's just talk to healthcare professionals. I hear what you say. I was listening, that's just talking with them the next day, for example. That would be a very easy starting point as your normal follow-up. As a midwife, a doctor, whoever has done the birth or been there, to just the day after, it's like, hey, that's something I do as a midwife. It's like, hey, how did you experience your birth? And reflect on it straight away. Because as you say, the birth might have gone 100% perfect for you as a midwife. But for the mom's experience, there could have been really things that she didn't understand or were hard or traumatic or whatsoever. So to straight away process it with her and allow her to talk, and that would be really a good start, right? Straight after birth to talk it through with your healthcare provider.
Absolutely. I don't think that will finish her story, because I think with time she's going to reflect, and she's going to reflect on her own performance.
Right.
Who was there for her, who wasn't there for her. But I think that would be great if people could start it off with that. So I mean, and I know they're just words that are thrown around, but I mean, how many women do we know who are subjected to emergency Caesars? And this word emergency is used erroneously. They're not emergency, they're unscheduled Caesars, or it's a long labor, it's not progressing. But then they come out and it was an emergency Caesar, and I nearly died, or the baby nearly died. There's so much of this sort of hyperbole, this big talk that goes on around it. Sure. And then that yeah, that can lead to huge feelings of guilt and shame. Was I right to want to push my baby out? Was I right to do this? Was I right to have an elective Caesar? And so if they could get someone who could unpack their decision making and make sense of it. When I meet parents with this, I seem to, and obviously as a midwife, I love this, but it's almost like a sort of little forensics for me. I listen to their story and then I think, oh, I think this is what was happening there. This is why they would have done that. And I'm assuming the head was, wasn't blah, 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 whatever. And I can piece it together for them.
Exactly. Yeah.
So it's great that you do that with your clients.
Yeah, I love to do that.
And maybe give them the opportunity at the 6-week visit when they've had time, when they're not just in that elated high phase, when they go back to either the obstetrician or the midwife at 6 weeks, to have a quick review of that again. Yeah. What knowledge gaps have you got? What are you not sure about what happened? Yeah. And I think for healthcare professionals, not to see it that they're being judged or challenged.
Yeah.
That it's actually, we are service providers to these people. We are there for them. They are not there for us.
Yeah, that's a very important point too, because I do think as healthcare professionals, I mean, it's already quite a bit of a hostile environment out there with all the suing going on and all of that. That we really always just, I can imagine, want to put up your defenses because, like, and it shouldn't be on that basis. It should be in a trust basis and in a, let's talk. That's really important.
But you bring up a good point. It is a hostile environment. And depending on which model you've been trained in, and it's very easy to be critical of the obstetricians, but they're trained in a medical model. They're not trained in a model that speaks to natural childbirth. Yes. So during their training, they're always called in to sort of handle the sort of messier side of obstetrics, or really when it isn't going well. And so then when they go into private practice, they don't bring a model that speaks to the sort of natural childbirth and they see it as a normal physiological event. Not all of them, but many.
No, it's absolutely true. And I know, I've been chatting with you just before we went on to this interview, and you also have had exposure. You're from the UK and know a model where it is midwifery led. And in South Africa, it's a bit of a confusing world. So as a new mom, you might just think, I need to go to the doctor, and then actually wanted a midwife-led approach, demanding that from a doctor that might just not give that to you. Yeah. So that's also, again, wrong expectations or expectations not met. So it's so important to be informed and also choose your right providers. Do you see that with moms that I regret who I've chosen? Or
I think, interestingly, just going back on one of your points, the majority of babies are birthed with midwives in this country. If you look outside of the private sector, in the provincial sector, majority of babies in this country are born with birthed with midwives. Right. Just punting the midwives there. Sorry, could you repeat your question? It was.
Yeah. So how important is it you choose your provider with what you are wanting to achieve your birth?
Yeah, but I mean, I'm sure you've made the same comments and jokes as we all have, that actually people know more about their hairdresser than they know about their obstetrician. Because if I ask you about your hairdresser, I can look at your hair and it's your hair that's attracting me.
It's been yesterday.
Absolutely. So, well, that's why I want the number. Absolutely. Whereas with the obstetrician, it's he or she was so nice. They were so kind and they were so nice. And you're like, come on, we can do better than this.
Yeah.
But do they put out their philosophy? Is it on their website? What is their philosophy around childbirth? So that would be so difficult. For me, myself, I was a practicing midwife at the time. And so I could choose my caregivers, and I chose them very, very carefully.
Yes.
But I knew their practice inside out. So, there's so much. It's a tricky one, that.
It is a tricky one.
So I think you'd have to speak to people are they testimonial? I don't know, actually. It's a good point. How could you? I think a philosophy of birth and, something on their websites, or that actually takes them out of just the white coat and the stethoscope and away from fetal medicine speak.
Yes. Yeah, so I think that is also what we try to achieve here on this platform, with especially talking to our moms and the first-time moms, is to really do your research if you can, see what your birth options are. And for some, it might just, your birth options is going to be the government hospital, and you will be with midwives there. And then you still need to empower yourself on how can I still have the most, that you are present at your birth, as you were saying in the beginning of the talk.
And present in your pregnancy.
And in your pregnancy, exactly. But we also really want to make sure that you are, if you can have more options like obstetrician or an independent midwife, that you just go ask those questions that are important for you, because you have the right to. If you really wanting to have a natural birth, then it would be wise to ask the obstetrician, if you choose that one, to ask him, what is your natural birth rate, for example? How many natural births do you do? And if he's got a 100% Caesar rate, then I would just not go there. So
if he had 100% natural birth rate, I also wouldn't go to him.
Exactly. Love that. Yes, absolutely true. Yeah, so I think those are just some tips for listeners to be aware of that.
That's a tough one. That is a tough one. And maybe it's something in your center that if people, I don't know, a way almost to say what their stories were, what was positive about. It's a tricky one. You're going to be thinking, how could we challenge that and approach that one?
Yeah. Okay. Well, we can go into a lot of nitty gritty, but I want to take us back to the good enough mother. Let's just come to a landing. Some things that you would like, that you want to tell parents about being the good enough mother.
Yeah, that perfection in life is never achieved in anything that you do, and any more than it would be in child rearing. And what is perfection? And that people can sort of run down a rabbit hole as well of, if they buy more equipment, that's going to make them better parents. And yet the research shows us, it's very interesting, that actually a child will be more resilient if they actually have to face a few little blips along the way. That when you start to strive towards perfection, is that helicoptering, is that feather nesting? And I'm talking along the spectrum of childhood. I'm not just talking about newborns. And that what is so important is that early attachment for the baby, and that you don't need all the gadgets under the sun for that. You need you to be present. And different people have different philosophies around it. But personally, I don't think, we don't own our children. They belong to the universe, but we have them for a period of time before they will go out into it. And your job is to, but that's my philosophy. So that's important. What is your philosophy around being a parent? But how to sort of going forward for the parents, to find some form of connection group. So if you can mix with like-minded people, and people maybe who are a little bit ahead of you in the journey, and you like what they say, that you feel secure in the way they approach you. And these could be peers, it could be, a clinic that you enjoy. To find out, just kind of find the right people for you to be with, who give you the space to be the person you want to be. That you're not actually falling into that competition cycle or this need to be perfect. And then one of the things that also is recognizing what your triggers are, and that because people who do strive, and it's not about, you want to be the best that you can be. That's without a shadow of a doubt. And we all want the best for our children. But to put it into the realms of, to be a little bit softer around the edges and a little bit fuzzier about what is you being your best is good. Because one of the things I do believe is that as soon as you start going towards perfection and you fail, that in this situation between the mother and the baby, it means in some ways the baby's failed as well. Because if she's not reaching her goals, why is she not reaching the goal? Because the baby didn't follow what it said on the back of a formula tin for sleeping or eating, which it never would. But has the baby failed? It all just becomes so, it's so hard. It's so harsh.
It's this hard world out there. Yeah. But you give some real good practical tips to surround you with like-minded people that you feel like that I can connect with what they're saying and their approach to parenthood. and not to get in that comparison trap. That is
and
really
to accept that you are doing your best. And this is going to be, it's a very hard physical transition to go from being a pregnant person to being a new parent. And your brain is changing. I mean, the neuroplasticity in the brain is amazing during pregnancy and early parenting. And it's physically changing, and you are supposed to be hyper alert. That's one of the things that you will, that they will find about themselves. And that's the brain's way of saying, almost to make up for the fact that you actually have no skills, no training, and you are on the job from the word go.
Wow.
And when I meet new parents, that's the first question. I don't ask them how old their baby is. I ask them how long they've been in their current job.
I love that.
And it's hard.
And
you're not allowed to have an apprentice status. You've got to be, you've got to be master of all from the word go.
No, unbelievable.
With performance reviews coming in from your family, your friends, everybody. So it's
So you and me know there's this big thing, and you've touched on it, but I would love you to just emphasize a little bit more the shame and the guilt. Like mom guilt is a real thing. I think every mom has it. So new mommies that are maybe pregnant for the first time, it would be good to be aware of that, and how you can catch yourself to not fall in that trap, because you forever feel guilty that you're somehow not doing anything. Something is, you're somewhere dropping a ball.
And a lot of guilt and shame also, it doesn't actually come from tangible reasons. A lot of it is also the what ifs. But I'm a great lover of, as a coach, obviously I'm a great lover of journaling. I think if people journal and if they're aware that they're feeling shame and guilt in their pregnancy, and they foresee that it might be an issue with them going forward, maybe every time they just have that trigger, like those are the guilt feelings and whatever, just notice it in yourself and see if you can start to build up what is it that's actually triggering that in me. And see if they can, because different people have different things that trigger it for them. But it just leads, the idea that I failed leads to guilt and shame in this, in the society today. And all of this is against the backdrop of ever increasing numbers of people saying that they're suffering from depression and anxiety. And I say it like that, and that's almost with a sort of caveat. I'm not dismissing that there is an increased number, and it's definitely due to increased awareness. But there's also an identification with I'm stressed, I'm anxious, which is something else I think we have to be careful of, that we allow people to say, I was anxious about this, I was stressed about that, but I am not an anxious, depressed person.
Wow.
But that's another whole topic. But
very important.
That there are
and
increasing numbers. I mean, when you speak to a group of antenatal parents and you say, you don't ask them to put their hand up on who's been treated for anxiety and depression. But I mean, the literature shows us that in South Africa, in certain areas, it's as high as 30%. So this sort of 10% number is way out. You're looking at least a third of the people have already identified with depression or anxiety. So if that's part of who you are going to be who you are as a parent. You can't change your fundamental personality. And you're going to bring in the added, yes, a lot of joy, but new parenting is a gritty, hard time. And you are going to bring yourself into it. So that awareness of that as well.
So I hear you. It's just to have good awareness and real expectations, realistic expectations. And that might reduce your level of anxiety then going forward if you're already aware.
It may not.
Depends on your personality, as you said.
Some people, you hear stories from some people and you think, okay, you're all right. And they go, I'm fine. Let's carry on. Show me how to latch the baby. And I'm thinking, I need to lie down after listening to that story. And then you'll have someone else who tells you a story and they're just sort of stratospherically disturbed by something that you kind of think, well, okay, all right.
So true.
But that's not for me to judge, because that's their experience and those are the feelings they're bringing. So we do bring ourselves into this new phase of our lives.
Yeah. No, absolutely. That's very, very crucial. Yeah. It's like they say, beauty is in the eye of the beholder. So anxiety is probably also in the eye of the, the person. It's their interpretation of a reality. Yeah.
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 Mm.
No, wonderful. Claire, I really think you've got a lot of wisdom to share, and I can see the main lines, and I can just imagine with taking it to an individual how you can have certain tools to help them in their journey. Is there anything else that you would like to share to our listeners before we come for a
So how I've sort of structured my practice is I have sort of 3 connection points, I'm calling them. So I have a group, a face-to-face group, and I'm going to start launching it on Zoom as well, because it's not just people who live in Johannesburg who have these issues.
Yes.
And that runs on a sort of loose, but it's a carousel kind of affair, that we have topics that we discuss. For instance, tomorrow it'll be how to manage the helping hands, so all that unsolicited advice. And those are face-to-face groups with other mothers, and the groups are not big, always include tea and a chat. And then I do face-to-face coaching as well if people have specific issues and things that they don't want to talk about in a group. And that's great. And that can be in pregnancy or post. And then I'm actually also an infant massage instructor. And so my infant massage groups, I try and bring in things that are like grounding exercises for the mothers, centering for the mothers. So I know the mothers are going to care for the baby. And I feel like, okay, my role here is to reach out to the mothers and give them some tools, grounding, centering, feeling calm. So that's another element. And then my lactation practice. And because, as we all know, that if lactation is not going well, that's just a massive stressor for any new parent, and they need support. And it's about the baby thriving in a way that's optimum for the mum and the baby. Yeah,
absolutely. So Claire, where can mommies or anyone that's listening find you, or if they want to make use of your services?
Yeah, that would be lovely. My website, which is just about up and running, is called, it's a very long name, but it's a long name because I think it describes what it does. It's the Good Enough Mother Connection.Africa. So the Good Enough Mother Connection.Africa, and they can email me through the website as well. And I'm very happy for anybody to WhatsApp me as well. Shall I give my number for that?
You can.
It's 082-077-1942. And obviously I'd ask people not to call me, but to send a WhatsApp message, and I can get to them.
Wonderful. Well, we'll put those details also in the show notes, that if people are wanting to reach out to you. So yeah, thank you so much for
you're welcome. Thank you very much.
Yes, and hopefully you'll be able to send some more mommies your way, because I think it's such an essential thing that you're doing. There's so much mom support needed in different shapes and forms, just to support them to be comfortable in being a mom and enjoy it, right?
Definitely.
Yeah. So all the best with everything.
Thank you very much.
Don't stop.
No, I won't. In fact, I'm quite keen to get into doing something, because I am actually my master's was in education as well. So I'd quite like to get into the sphere of putting together something for healthcare professionals in this as well.
Amazing. Yeah. Awesome.
Thank you.
Look forward to see that. Okay, Claire, keep well. Thank you so much.
Thank you.
Okay, bye. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, You're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.